Oily skin, people are bothered by it. Some people do get acne, of course, from oily skin. Some people just get a sheen to their face. Oils are produced during the day and it just doesn't look good. So they're wondering, can I decrease the oil in my skin? What kind of cleanser should I use? Should I scrape it off? Should I use an exfoliating type of brush? Does it work? What about those strips? I'm talking oily skin today and my 6 tips for oily skin and a lot of things that you shouldn't do. There's a lot of myths for oily skin and we're going to cover them today. In the comments, I want to hear your tips and tricks as well. I'm Dr. Rajani and I'm trying to save you time, effort, and money with these videos. Remember to like and subscribe. Oily skin. Okay, many have asked for this. It happens when the sebaceous glands in the skin, they make too much sebum. S-E-B-U-M. Sebum is that waxy, oily substance and it protects the skin and hydrates it. It helps that all-important barrier on the stratum corneum. The sebum is vital for keeping the skin healthy. It actually is fully functional and you need it. You don't want to scrub it away, contrary to what people think. However, too much of it can lead to that oily skin look. And yes, a lot of people ask, does it actually cause acne? People that have too much production tend to be those that are producing acne and they're having problems with acne. And it can wax and wane different times of the month. And it can be hormonally related as well. It's also genetic and certain foods can cause it. I'll cover a couple of those as well. But the clogged pores and the acne are certainly what drive people to ask channels like this, your physician, your dermatologist, about the solutions for sure. Managing oily skin often requires that a person make regular skincare a habit, a routine, and that's what we talk about on this channel. And it's not just 1 or 2 nights of doing it, it's often a week or so, 2 weeks, 3 weeks. For some systems, it takes actually about 6 weeks, and sometimes there's a little bit of a purge of acne before it gets better. Today I'm talking about the 6 ways in which you can reduce the symptoms of oily skin without prescription strength drugs. So it's things that you can do at home. Washing regularly can reduce the amount of oil in the skin, certainly. I always advise wash with a gentle soap and warm water. Now people hear soap and they get scared, but a lot of people, if you're traveling or people don't have access to cleansers and it's something they don't want to spend the money on. So if you are using a soap, it should be mild, gentle, and just warm water. I recommend a cleanser. And I think this is better because you know it's gentle, it's made for the skin, and the pH is balanced. Something like La Roche Gentle Cleanser is what I often recommend, and I put that in the links below because it's simple, it's basic, and it works. There's also salicylic washes. Now, if you're going to pick an ingredient wash, that's what I like best. It's gentle, you can wash, and then you remove it so you don't get irritation. Double washing, let's touch real quick on that. I do like it. I think you do single washing first. Try that for a few weeks. If you need something more, double washing is fine. That refers to using a wash, a basic wash, and then following it up a minute or 2 later with salicylic wash or medicated wash. For many people who simply have oily skin and don't have the acne vulgaris, fragrance-free glycerin soap and hot water may even do the trick. You just have to test this out for yourself. Whatever you do, avoid soaps with fragrances. That's number 1. Added moisturizers, because if you need a moisturizer, do that as a whole separate step. And of course, harsh chemicals. A lot of times you find the pH is off. You want to avoid those because they can irritate and dry out the skin. And then you don't know if it's the skincare that's irritating or the wash. So the most basic you start with, the better. One thing's for sure, avoid those loofahs and rough washcloths. A lot of people want to exfoliate and rub off the acne, wipe off kind of the pores and the whiteheads. But that doesn't really work. And in fact, what's going to happen is the body sees irritation and it wants to produce more oils. And people get into this cycle and it's never ending. Remember, in medicine, what we do is we make one change at a time. We check that change and see what effect we have, and then we move on to the next. That way we know each step of the way what's the causative factor. So keep it simple initially with the washes, but don't rub, scrub, or do anything harsh to the face. The next step is to try some dedicated acne skincare products. These usually contain acids that can tackle the oily skin. Some that you might see commonly, and one of my favorite is salicylic acid, which is a BHA, a beta hydroxy acid. Next we have glycolic acid, and that of course is an alpha hydroxy acid. And then we have benzoyl peroxide. I have a whole cream called my AHA Advanced Firming that has AHAs in it, alpha hydroxy acids. They are usually fruit-based acids from sugars. And don't let the word sugar scare you, but they're very effective at helping and treating acne. The downside of both of those are that you can get dryness from it. So a lot of people don't want to use a moisturizer and think that's bad, it's going to cause more oil, but actually quite the contrary, there is a balance there. For that reason, I have a whole cream called the Ultra Moisture, which contains oils, antioxidants, and it does not cause acne. It's non-comedogenic, and it's great to couple with anything that you might be using that causes dryness of the skin. A lot of people do use retinaldehyde or retinols. Those are non-prescription. Your retinoics are your prescription. But retinols and retinaldehydes, I have a whole video. I'll put a link up here and at the end of the video on a tutorial for retinols. They are a mainstay for acne therapy as well. And sometimes alternating an AHA, alpha hydroxy acid cream, with a retinol or retinaldehyde is a great way to do it for those that want to mix it up a little bit and can't tolerate retinols all the time. Now, toner, let's discuss this, because normally I'm not a big toner fan. I like to keep it very simple for people, but astringent toners that contain alcohol will tend to dry out the skin. However, natural ones such as witch hazel can have skin soothing properties, so they may be worth trying. Witch hazel has a high tannin content, and it makes it a natural astringent, and it's also anti-inflammatory. So many people with oily skin use it, and that could be the only toner that they need, because the oils, of course, can lead to the acne, and as natural and as mild and astringent as possible. So overall, I'm not a toner fan. In some people, natural astringent toners can make enlarged pores seem smaller, and they can remove small bits of product or makeup that could clog the pores. So there's a little added benefit there. However, these may not work for everyone. Some may find that their face tingles or itches when using astringent toners, and if that happens, it may be a sign that the irritation could lead to more sebum production. Remember, I said that if you scrape the face or use an abrasive type of pad, your body responds by saying it's irritated, produce more sebum. So again, there's a balance there, but witch hazel is something you might think about trying. People should test out any new toner on a small patch of skin and avoid any potential irritation from contaminants therein. So keep it simple again. Now, when drying, so we're still on cleansing, I mean, it's that important, but pat the face dry. When drying the face after washing and using the toner, people should gently pat their skin. The reason we pat it is some people tend to pull the skin down with a towel, or even a rough washcloth is of course worse. And we don't advise that, because pulling the skin down and rubbing it, that's enough irritation, believe it or not, to cause increased sebum production, the exact thing we're trying not to do. Blotting papers are good, medicated pads are good. Many companies are making blotting papers now, and they're specifically designed absorbent papers that pull oil from the skin. I think half of it is just the habit of blotting versus rubbing, because it's so common. Pretty much everyone you see rubs their skin with the towel. So the medicated pads are good, but if you don't want to invest, try patting the face first. Blotting papers will not treat the sebum production in and of themselves, but they can be used to lift off the excess skin throughout the day and make it appear less shiny as well. And that shininess is what leads a lot of people to treat their oily skin, especially if they don't have acne. They don't mind the oils as much, but it's that shiny color, especially it seems in the forehead. That's why anytime you're on camera professionally, they're always trying to get a flat sheen kind of to the face and not that oily look. A person could also try cloth pads to that end. They can be medicated with familiar cleansing ingredients such as the salicylic, I mentioned, the glycolic acid, and they may help to remove excessive oil through the day as well, while cleansing the pores and the skin. So there's a lot of choices, a lot of product. I think blotting papers or blotting without the papers initially is by far the way to go. Facial masks. This is where I can get behind the use of facial masks, especially if people aren't overdoing them, because a lot of people tend to use them every night. Don't use masks that frequently. Certain masks may be beneficial for treating oily skin. The ingredients that I tend to like, number one, clay. So masks containing minerals like smectite or bentonite, they can absorb oils and reduce the skin shininess, and the sebum levels then thereby decrease, and they don't irritate the skin. That's what I like about them. Use them only occasionally, like I said, and prevent the skin from drying out by using a moisturizer within an hour or two after. The moisturizer I find is key because there are active chemicals in real clay masks. Here's one for you, and we know it from my other videos on boosting the immune system, and that is honey. A 2011 study reports that natural raw honey, and I think that is key. I use organic honey, but I think it should be natural and raw because you don't want any additives. It's been shown to have bacterial and here's the key, because honey was used in wounds, antiseptic qualities. And we know acne has a bacterial component that we often talk about. A 10-minute honey mask may reduce acne and oily skin while keeping the skin soft. And that's what I like about it. It doesn't irritate the skin. Along those lines, oatmeal is another great one. Masks containing colloidal oatmeal may help to cleanse the skin, and suggested in a 2014 study, this seemed to work very well. Oats contain gentle cleansing saponins, antioxidants, and once again, anti-inflammatory compounds that should soothe the irritated skin. So especially if someone's already irritated, if they're using pads, the oatmeal tends to work well there. Number 6, apply moisturizers. So moisturizers may benefit the skin, but the right ones need to be used. While many people with oily skin, they just steer clear of these for fear that the oils in the moisture add to the oils in the face, and it doesn't work that way. I have an Ultra Moisture, and you can look through the ingredients list there, a lot of organic oils present within it, but it doesn't cause acne. I use it as a finishing cream, so if people want to put on just before adding makeup, it smooths everything, and it fills folds and fine lines, doesn't cause acne. And I first made it and came up with it for people who lived in coastal areas, because surprisingly, yes, there's a lot of water around the coast, but people that live on the coast, often there's a lot of wind and they have dry skin you just can't get on top of. So that's how that Ultra Moisture came to be. A 2014 study suggests that aloe vera could be a good moisturizer for treating acne and oily skin. Certain compounds in aloe vera can have a naturally soothing effect, and we know that from wound and wound care. The study noted that the product should have at least 10% aloe vera to be effective. So that's a good number, because when you get it, you go to the pharmacy, you see sometimes the percentages are very low. Some people choose to use pure aloe vera gel for moisturizing, but they need to be aware of the hidden ingredients, especially denatured alcohol. Everyone I seem to see has denatured alcohol, so be careful. Alcohol is not good for the skin. It dries it out, and it also, of course, irritates it. Aloe vera gel is available in many online stores, and a lot of people have plants around the house. You can crack that plant over and open and use it directly. Now, prevention. Oily skin that's linked to genetics can be difficult to prevent. That's one thing you find. Genetics do play a role. I mentioned hormones played a role, and diet can play a role. Even oily skin caused by changes in hormones, it's difficult to treat. And by adjusting the hormones, sometimes people go on birth control and different things. It still can be hard to get those levels right for levels that work with the skin, work with people's psychology, and of course cycles. So it's a very tough balance. The best prevention for oily skin is as an individual is to find consistent skincare routine. Consistent's a key word that works, and you got to stick to it even through sometimes a little bit of a bad purging time. When oily skin arises, it can be tempting to hide it with makeup, but certain products, particularly oil-based products, could make symptoms worse and clog the pores. So prevent this by using water-based makeup. It may be a better option for those people, while others find wearing no makeup works best. And we always try in this channel, wake up, no makeup, by doing different laser treatments and allowing for skin glow and removing reds and browns. The less you put on the face, the better. Many people also say their diet is what keeps their skin from acting up. You hear that all the time, or they more rather blame their diet. It may help to stay hydrated, of course, and greasy foods such as fat, they have been implicated, but the two most glaring are dairy and sugars, and they've been shown to cause and make people more vulnerable, I should say, to getting acne. And there's certain definitely physiologic mechanisms for those. Some people talk about chocolate, but that's up in the air. I would say the two first ones to get rid of are sugars, which of course is going to help you anyway, and the next one is going to be dairy. And I hate to come down on dairy all the time, but you can ease it back in as the acne goes, and there's so many substitutes for it. And of course, you know, here on this channel I like oat milk, almond milk, and then if you like dairy, you can introduce it slowly back in, organic dairy. Oily skin, it bothers a lot of people. I put a video up here on how to reduce pore size. Pore size is tough. There are things that you can do. Stay tuned, keep your skin and body beautiful, healthy, and vibrant.